East Tennessee providers say more people are seeking and requiring behavioral health treatment, and that is why Blount Memorial is no longer accepting inpatients and instead focusing on outpatient care. 10 News reporter Grace King explains the impact this decision will have on people and the community. Grace.
Robin, right now this means 16 fewer inpatient beds in the East Tennessee community. But there are more than 200 inpatient beds coming in 2022, which means the impact will likely be absorbed.
There's 16 beds closing will probably not have as big an impact as some people might think, because in Knoxville there are a number of hospitals that are about to open.
In 2022, there are 2 new behavioral health hospitals set to open, and a third center is in the early planning stages.
If somebody is in danger of hurting themselves or unable to care for themselves, they really need to be in a hospital type setting.
The McNabb Center CEO, Jerry Wagner, says those will help to fill critical gaps.
We've seen somewhere in the neighborhood of 10 to 20% bump from prior years, and I think that's just indicative of the stress people are under during this period of time.
The McNabb Center focuses on outpatient care, which is a growing need.
Treatment is effective. People can get well and they can recover from these kind of conditions. In the absence of treatment, sometimes they just exacerbate and get worse.
No matter what kind of care you need, McNabb CEO says it's just a phone call away.
So our community is rather blessed to have an array of services in the behavioral health community that people can access, from just wondering if you have a condition and calling somebody for sort of a screening or assessment, all the way up to hospitalization.
The third psychiatric center is planned for the Old St. Mary site in Knoxville and will also feature emergency care. The timetable for that project is unclear. Robin.
Grace, thank you.